I now recognize Dr. Bera from California for 5 minutes of questions.
Thank you, Mr. Chairman. From day one of this pandemic, unfortunately, politics has kind of infused a lot of this. And I know this, obviously, Dr. Redfield, you and I had many conversations. In my time in Congress, one of my focus areas has been global health security, pandemic preparedness, have sat on national task forces at CSIS to prepare for global health securities. We put out our recommendations, unfortunately, in the fall of 2019 and have pushed to put that framework in place. My colleagues, Congresswoman Dingell and Congresswoman Ross, have equivocally said, as Democrats, we want to find out what the origins of COVID were. Early on in the pandemic, in January of 2020, I pushed personally as hard as I could on the Trump administration to do everything they could to get our scientists to the hot zone, to ground zero, to actually get a sense of what was going on. I'm not going to defend how the Chinese Communist Party has handled this pandemic. They've stonewalled us. They've played politics. Dr. Metzel, you talked about the importance of the WHO. They played politics with the WHO recommendations, and until we actually can get to the hot zone, I don't know that we'll ever get the data. This is not a partisan issue. In fact, on the Intelligence Committee, which the chairman is on, we marked up the COVID-19 Origins Act in a nonpartisan way. It passed, out of markup with a voice vote. We will all get a chance to vote on that bill on Friday. I think you will see a strong bipartisan vote encouraging the intelligence community to declassify as much information as possible so the public can see the information that we have. It's not conclusive, but we've got to continue to try to find the COVID origins. I think it is reprehensible that we're disparaging, some of our greatest public health individuals, Dr. Fauci, who I've known for a long time, and Francis Collins, who I've gotten to know. Both are outstanding scientists and so forth. They may have had a different hypothesis. We should entertain all hypotheses, and we should do it in an objective way to find the answers. I also hope we don't, as a body, take the wrong lessons from this. Dr. Metzel, you talked about the importance of the WHO. I'd like your opinion on international collaboration is extremely important, not just in pandemic preparedness, but also in biosecurity work and so forth. We have to have the systems in place to identify pandemics fairly quickly, to think about how we address it, because whether this was man-made or naturally occurring, bad actors are out there who just saw what a virus did to the entire planet. Those technologies are readily available. You come from a national security background. How important is it to work with our international partners here?
It's absolutely essential that we work with our international partners and with the WHO, and as has been said repeatedly, when those international partners or potential partners themselves are bad actors, which is absolutely the case with China, that makes things a lot more difficult. And then the World Health Organization, which is absolutely essential, is working with one hand tied behind its back. It doesn't have the mandate or the authority to do what it needs to do. It couldn't have its own independent surveillance capability in the beginning of the pandemic when China was preventing the WHO investigators from going to Wuhan. There was nothing that they could do, and as I said in my remarks, Dr. Tedros has actually really been at the forefront of fighting for the kind of open inquiry that the Chinese government has so aggressively blocked. And if I can just say, just very quickly, I'm originally from Kansas City. I'm a Midwestern optimist, and so I hear some consensus in the room that it's critically important to understand how the pandemic started, that we have to fully examine all origin hypotheses. It's my view, as I've said before, that China must be the primary focus, but we also have to look at everything, including ourselves. But if we make this process primarily about Dr. Fauci, even though we need to look at everything, if we make it primarily about Dr. Fauci, we will be inappropriately serving the Chinese government a propaganda coup on a silver platter.
I couldn't agree with you more. Let's get to the facts. Let's discover the origins. Let's do what we can to prevent the next pandemic. Let's increase our safety and biosecurity. You know, we should debate gain-of-function research. I think that's totally appropriate. We should make sure if we are looking at that it is done in an absolute safe way with oversight, et cetera. We should also think about the private sector that can operate, you know, and do this research on their own. We ought to think about how we also look at that and make that safer. Thank you.
Now,